guys, we're gonna give it a shot again. I do not know what is going on with Instagram right now. My Instagram, even on my iPad, is only loading in a small square. So it could just be updating my Instagram because Dr. Serrano said he can hear other lives. Joette, do we have any sound? Check, 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 sound, check, check, check. How are we doing? Do we have the sound? Fingers crossed. Yay, I think we have sound. Okay, I honestly, I don't know why I'm in a little window. I don't know what Instagram is doing, but let's just cross our fingers that it works this time. Yay. Technical difficulty Monday for Dory. So we'll wait for Dr. Serrano to pop in. I'm glad we finally have some sound. This might be our moment. This might be the shot. So I'm going to let him know that we apparently have sound. Looks like we got sound. And then that way we can hang out. This is going to be such a good talk. I'm so excited for this one. I've been looking forward to this one for a while. Hello. And we have sound. So let's get you in there. Yay. Oh my goodness, I'm so excited. Oh, it's one of those days. Yay!
It is one of those days. It's Murphy's Law.
Oh, we have sound. This is awesome. I don't even know what's going on with my Instagram. It won't even pull it up on my full iPad right now. It's in a little square, and I went, we're rolling.
Let's not move it anymore. Let's just leave it as it is.
Yes. So, why don't we start with introduce yourself? I have a lot of new people on my page in the last couple of months. So I have a feeling that several of them don't know who you are yet. So let's start with your name and what you guys do at your clinic.
Okay, so I'm Dr. Jorge Serrano. I'm the medical director here at Baja Med Group. We're a medical practice. We're located in Mexico. And the main purpose of our practice is to see patients from all across the globe. The majority of our patients do come from the U.S. and Canada. We do see a lot of patients, though, from the UK, Australia, and other parts of the world that need some kind of specialized medical care, and they come see us, whether it be plastic surgery, bariatric surgery, orthopedic surgery, spine surgery for lower back pain, cancer treatments. We have dental practice as well. And so basically everything that has to do with healthcare, and we offer it to patients that come from abroad.
And it's amazing. You guys even do fertility. And I know that a lot of the ladies on my page are struggling with PCOS and fertility issues. Yeah. So we're excited to hang out with you today. And today we're going to talk about some of our loose skin issues.
I am as well.
A lot of our people are in that situation.
How are you doing, Corey? I was very rude and I didn't ask you how you're doing, how your travel went. How are you feeling?
It was so good.
Tired?
I'm a little tired, but it was worth it. You know me. I run on energy and love, and all of the people around me just give me so much energy that I can't complain. But it was a long weekend. Late nights, early mornings.
Of that.
We get through it, though. And laughing and loving people through it is what makes it worth it. So I want everyone to know
what you do.
that I met you so long ago. Like when I had my surgery 8 years ago, I was fortunate enough to be one of 3 of the first ever Canadian patients that you saw, which gives us a special bond.
Yeah, but most of our patients came from the U.S. and then you came along and then you introduced us to the beautiful, wonderful people of Canada. And so it literally was like getting a foot in the door, and it's been a domino effect since. And we're very happy to see patients from the U.S., from Canada, that, a lot of people that come see us, it's usually by word of mouth. I mean, obviously we do have a marketing team and so on, but most patients come see us because of word of mouth. And so, yeah, we've been in this game for just about a decade now, in the international medicine, the globalized medicine kind of deal. So, yeah, we're very happy. And so I do understand that you have questions for patients that have either had massive weight loss or because of diet and exercise, or some people that have had it through post-surgical weight loss, right?
Yes, and I find
that's the order of business today?
Yes, I find my group is honestly pretty split right down the middle. A lot of my people have had weight loss surgeries like me, and with such a drastic weight loss in such a short amount of time, the skin doesn't seem to return the way that I would love it to. Like, I would really, really love for my arms to not do that. Do they look better than they used to? Yes. But this is all just skin at this point. There's nothing in there. And we're finding discomfort with this. I mean, in the summer, it's hot, it's uncomfortable, you get rashes in these areas. It's not always just about being aesthetically pleasing. It's not, for me, it's not just about wanting to walk out on the beach and say, oh, look at my sexy body. For me, it's about the logistics of getting around, comfort, fitting in my clothes, being able to walk comfortably without, sagging stomach skin. That's an issue for lots of us. So let's start with, where in our journey should we look at that? Because you need to lose a certain amount of weight and maintain that for a certain amount of time, right?
Yeah, right. So let me set it up a little so that we can kind of get a good flow going, and then then we can start asking, or if some of your audience has some questions, we can tackle them. Okay, so for all intents and purposes, massive weight loss is whether it be from surgery or from diet. It's going to be, for all intents and purposes, right now we're going to treat it as the same. It is not, if there are some purists out there, but that's why we evaluate every case or every patient on a case-by-case basis. But for the purpose of this conversation, let's just group them together. Okay, so this is actually a field that's so new. Patients losing so much weight that we're learning more and more about this. Okay, we're getting more data about this, more clinical information, more relevance from certain physicians. So we're doing a collective effort as a medical community in order to try to give the best possible follow-up care to our patients. So just to start off with, so patients that have bariatric surgery, for instance, or that have been in a stable weight for 14 to 18 months, that's when we can say, okay, you are ready for one surgery. Why? Because there are certain proteins in your body that kind of need to balance themselves out after going through so many metabolic changes that we have to let the body be in good shape before getting you into the OR. Okay. And so, I mean, just as an example, we had a patient just last week that lost 200 pounds. And he came over for about 3 different surgeries, right? And I told him, let's call him patient A. And so I told A, I said, we first have to make sure that you are that we have a plan A, B, and C of priorities of what we are to do in the OR, and see how your body responds to that. And so obviously we did have a plan. We started with a torsoplasty, a male, and then just removing a bunch of excess skin that he had in his upper body, or some people call it an upper body lift. And it was about a 4-hour surgery, and just for that one part of the body. And so at that point, we started to, safety is our number one concern, as in our practice. And so after, the surgery took a long time, and we said, well, why jump into another surgery that's going to take about another 2.5 to 3 hours? So we just stopped at that point. And so there's no rush, because jumping back to the initial, to answer your question, is that whenever you do post-bariatric or post-massive weight loss surgery, you want to think about the big picture. The first surgery that you do, it's big picture. It's not details. It's not how you're going to look in the mirror, per se, over a specific part of your body, let's say love handles or the arms, for example. We're looking at big picture. So what do I mean by that? Midsection. That's what you want to address first. So whether that's going to be the midsection and a circular abdominoplasty or a tummy tuck, to make sure you get rid of as much skin as you can, that's a great first step. I always tell patients, do that first, because that's going to be the area that's like, it's your center of gravity. It's your focal point, and from there you can branch out. So from there we can start doing procedures like in women, breast lifts, or in males, torsoplasties. We can do circular abdominoplasties. We can do arm lifts. We can do leg lifts, liposuction. I always usually tell patients to leave lipo towards the end because that's for the fine tuning. Okay, but what we're doing at this point is not even plastic surgery anymore. It's reconstructive surgery because we're basically reconstructing the body to try to get it into an anatomically correct shape, whatever that means nowadays. Now, what I tell patients is that, we have to be careful now with everything you say. So, and obviously, everything I say comes with a medical inclination, not anything based on bias or any of that sort of things. Now, going back to the discussion, those small details can take, from the moment you do your first surgery, it can take up to 2 years to do it, or the whole transformation, so to speak, can take up to 2 to 3 years. Okay. So, starting with that first big surgery, you're going to feel like a bus hit you head on maybe the first time because you're doing a massive change to your body.
Yes.
You have to take it very easy for the first 4 to 6 weeks. Focus on recovering, wearing compression garments, doing a lot of things that most people don't even think about. And that's one of the caveats that I always tell patients. I'm often asked, what is one of the things that patients overlook when having these types of procedures? Okay. And I say is underestimating the post-op, the immediate post-op process. Okay. So, for instance, if you have a big surgery like an abdominoplasty or a circular tummy tuck to remove a lot of excess skin, most patients want to go back to work in a week or so, and I tell them no. I mean, you're doing a massive change to your body, so whenever you're planning, you want to make sure that you have planned for enough time to recover after surgery. Okay. 2 to 3 weeks. Preferably around the 3-week mark, because for a while you have to be, hunching over so that you're not putting a lot of pressure on the suture site that we made. Making sure that you don't tax your body a little too much, because if that happens, you start running the risk of forming post-op complications that are very easily avoided if you rest. Okay, so when you undergo so large of what we call hemodynamic changes, basically meaning when you're changing your surface area so much by removing fat, skin, your body, you throw it into a little bit of whoa, what just happened? Okay. So you have to give your body enough time to recover from that so that you can actually have a positive recovery. And then, once your body is ready, you can go back, work, be a mom. But you definitely want to have enough time to recover from surgery. Okay.
And what about things like hair loss? Because when I had my bariatric surgery, that was one thing, I wasn't kind of prepared for that. I'd never had a surgery of any sort before. I'd never had any anesthetic, and I was a little bit surprised. And I hear a lot of people that have had weight loss surgery, and they're like, oh my God, I'm losing my hair.
Yeah, usually what happens is that when you lose such large amounts of weight and you're going through these metabolic changes, there's a protein in our body that can decrease in level. It's called albumin. Okay. When that happens, that has a strong correlation with hair loss. So when your albumin levels go down, your hair can definitely start to thin and you can lose some hair. So I always tell patients to start on albumin supplementation even prior to surgery, and then obviously post-surgery as well. And that can, if not stop the process altogether, it can make it a little slower, or it can just make your hair a little thicker. Okay. So if you have thin hair beforehand, you definitely want to take that into consideration before going on a diet where you're gonna lose a lot of weight, or if you're gonna go through surgery, that as well.
Well, and I love that because I have actually covered this topic with keto doctors, and the only thing that they can say is that hair loss isn't keto related. It's not keto. And the ladies are coming to me and they're saying, Dory, I've lost so much weight, I'm losing all my hair. It's got to be the keto. And all I can tell them is, no, it's not. Well, it's not keto related.
To be quite frank with you, I don't know of any clinical correlation between when you are going through ketosis and it affecting a hair follicle. I mean,
Okay.
I can definitely look into it. I mean, I'm not a walking encyclopedia, but I mean, I can definitely look into it. I'll research it and I'll let you know. But
I would
from
love
my
that.
immediate knowledge, I don't know of any. I can't see any pathway that would lead to that.
Okay, so then we just need to take that supplement. And where do we find those? Is that something we can get over the counter?
You can find it in your good old supplementation store.
Okay.
I'm sure that if you've recommended an online store or one in Canada to your followers, I'm sure they can find albumin there.
I will research it for them and find something to post today, because I know a lot of us are struggling with that. And the general advice that we're getting is to take more collagen and gelatin is the general advice. So,
yeah, so
I'm
basically
looking
what
forward to that.
happens when you lose massive amounts of weight is that a lot of structural proteins in your body that aren't as strong anymore are going to be exposed, like collagen and hyaluronic acid. Those are the two biggest structural proteins that we have in our body. And so, like for example, what you showed us in your arm is basically, since you lost a lot of volume there, those structural proteins aren't really doing their job anymore.
Yeah.
So basically what we have to do is we have to remove that portion of the skin.
Yes.
And give it a little more firmness so that we can get rid of that skin that's not really doing a function anymore. Remember, the skin is basically, its main function is to become a barrier among other functions that it has. But if it's being a barrier to nothing, then you really don't need it.
Well, and it limits me in lots of ways. I mean, not just in the appearance, but for movement, for different activities. Exactly. It gets in the way. It's uncomfortable. And I know a lot of people feel like these kinds of surgeries are just for aesthetics. It's just vanity. You're just being vain, Dory. And for me, it's about comfort.
So, for instance, the patient that we had right now, he was getting some ulcers in the skin folds where he had the massive amounts of weight loss.
Yes.
So that's important. I mean, that can lead to very, very complex medical issues that can become a problem for the patient. So, no, it's. I mean, like I said, this is falling under the category of reconstructive rather than plastic surgery. And so, when you have that apron that people call, or that skin flap, and it's not helping you in any way, shape, or form, then you can definitely remove it so that you have healthy skin. Okay. Most people that have these excesses of skin in the abdomen or in the chest, in the back, you're actually going to be a lot better off without it, rather than just saying, well, I don't want people to think I'm vain, so I'm just going to leave it there. No, it's something you have to do for yourself. And like you said, it is a physical impediment, because most of these people that have lost a lot of weight, they want to keep it off, right? Well, who wants to gain it back? So they say, well, you know what? Now I'm going to go to the gym. Now I'm going to do all these exercises and, go crazy in the gym. Fine, go, be safe, don't overdo it. But you can't, having that excessive skin limits you, okay? And it's going to limit how you move in order to burn more calories in the gym. So I don't see it as a vain issue at all.
Well, and I'm going to give you a visual. Imagine that you're on the exercise bike, and every time you bring your leg up, it's hitting on the bottom of your stomach. You're not getting effective movement. You're not. Yeah. I'm not working out properly. And some of it is happening on its own. It's taking a really long time. When I look at the fact that it's been 8 years now, I have been on my journey for 8 years, and I never imagined that 8 years later it wouldn't, it was just going to snap right back, dude.
No.
That skin was going to come in.
Me, and me, I'm very straightforward, and I don't mislead patients. And they ask me, hey, Dr. Will, do you think I'll have some skin regression? 9 out of every 10 patients will not, okay?
Yeah.
I mean, when a young patient comes over, male or female, that wants to get rid of a small pocket of fat, and they wear a compression garment religiously, well, yeah, I mean, they might be lucky enough. But for the most of us, if we happen to have a surgery like that, that's not going to happen, just point blank. It's just that the physiological and the anatomical barriers that we have working against us. They just won't. It's very difficult for that to happen. Okay, if you just lose the weight, or if you, let's say, even if you just like do massive amounts of lipo on a patient, and then you have loose skin, it's not going to suck itself back. The physics won't allow that. Okay. So, when you remove those excessive amounts of skin, then you can be plain. So that's where the term tummy tuck comes from. The medical name is an abdominoplasty or a lipectomy.
Oh,
and so so when you remove that then you have you tucked your tummy. Okay. So that's where the term comes from, and you won't have that excessive skin kind of getting in the way.
Okay. So when we're talking about these surgeries, I have ladies who have multiple issues. Like, and I'm going to steal Jessica's term because I think this one is hilarious. She calls them pit tits. But it's this weird, like, what is this?
I've heard it before.
What is that weird little bit that sticks out? And then we get the swoop that it looks like somebody's going down a ski slope. I'm like, okay, the shape is not so bad.
Yeah.
The sagginess, better than I thought it would be. Because I went from like a 52 Triple H to right now I'm currently a 36D. So not so bad. I will say my girls have gone through weird phases. And it's so bizarre. One day they'll be normal, and then the next day I'll get up and they'll be like coney and weird. And then in a week later, they'll kind of tighten up and round out. But I'm left with this really weird, it's like it's hollow on the top. It's like the roundness starts on the bottom.
Yeah. That's very common. It's extremely common. Okay, and that little area right here in the armpit is, it's like in the middle of nowhere. Okay, because when we address a breast lift, you're addressing the breast.
Yes.
When you address an arm lift, you address the arm.
Yeah.
Now, usually when patients combine a breast lift with an arm lift, it's a surgery that actually goes very well together.
Okay.
We can tackle that little area, okay? But yeah, the problem that you're mentioning here is called the upper pole of the breast. And so you can have a loss of volume because of a few things. So number one, with weight loss comes a decrease in the fat tissue from the breast.
Okay.
And obviously that's an area where most women would say, well, I'd love to keep that, but your body has other plans.
Yes.
And so when you lose fat, you can also lose some glandular tissue in your breasts.
Okay.
So making your breasts smaller. So basically, I'll use a term that a lot of patients use, and now I'm left with deflated balloons, right?
Yes.
So, you basically lost all of the volume. Okay.
Yes.
So yes, fortunately there are ways around that, and so what you have to do is you have to do a complete breast remodeling, and so the technical term for that is a complete mastopexy, which is basically a complete lift of the breast, and some patients call it an anchor lift.
Okay.
Because it has the shape of a little circle and a line going down, and the little happy face at the bottom, which gives it the anchor look.
Okay.
And that's basically the suturing pattern that we use. So we remove a bunch of skin from the middle portion of the breast, and when we bring it all together, it gives the appearance of an anchor. Okay.
Okay.
So what we do is, in order to give you that volume in the upper breast, so that you can wear a low-cut dress or a V-neck shirt, and give yourself the nice fullness in the upper portion of your breast that you once had, then we can do that with the help of an implant. Okay. Now, this is where not getting too much into the plastic surgery aspect of it, but you have the under the muscle, over the muscle. So usually if you give the patient a pocket, a submuscular pocket, the under the muscle, you can give a good projection in the upper portion of the upper pole of the breast. Okay. And that way you can have that volume back again without giving you quadruple Ds again. Okay.
Yes.
So all you need is what most people don't know is that implants aren't necessarily made to give you volume. They can also be used to give you shape.
Well, and that's my issue. I don't want to be bigger.
That's where the personalized consultations come into place. Yeah.
Okay. Because I think...
So you remove a lot of that skin so that you can give you form, and then at the end you just place an implant, and that will give you the shape.
Yes. I feel like for the size I am, the size of my breast is equivalent. I don't feel like they are too big or too small for me, and I don't feel like if I got them lifted that I would necessarily want them to be larger, but I would want them to be a better shape. I don't like the ski slope. I just don't.
Well, we can definitely help you with that, Dory.
Yay! So now I'm close to where I have to leave to pick up Jacob, but I want to talk about how long in between surgeries, because now we've touched on the first one should be the tummy, should be your first, and I know a lot of ladies are going to want to go for the boobies first. I'm not going to lie, because they're like, but the boobies are what everybody will notice. It will distract them.
When you so let's say if you just do a breast remodeling first, and then they want to do, let's say, an abdominoplasty or a tummy tuck afterwards, there's a good chance that when a tummy tuck is performed, you lose a little more volume in the breast. That's just a physiological change, because you remove so many fat cells from the body that it can trigger more fat loss. So that's just something to take into consideration. Now, a transformation like these, the last thing you want to do is hurry it, okay?
Yes.
You want to take your time with it, because you want to do it properly and safely. There are a lot of places in the world that'll say, yeah, sure, I'll do everything.
Full meal deal.
You just have to stay 2 nights in the hospital, and then that's a big red flag in our opinion. Okay, we would much rather take it slowly rather than just have a big payday, so to speak. Okay. So if we do, let's say, an abdominoplasty and the patient goes back home, recovers, we usually ask, for you guys in Canada, it's great because you can go to your GP and say, hey, can I get some follow-up lab work? Yeah. And then we look for certain parameters in the blood that after 3 months, should start getting back to normal, so to speak. Okay. Or to surgical candidacy levels, let's call it that. Okay. And so if we see that certain parameters are there, we can say, okay, you know what, we can see you in a month, or we can see you in a couple of months. And if you're not quite there, we can give the patient certain instructions on how to make it a little better, or better on their body in order to have surgery quicker. So the take-home message is it can be anywhere from 3 months to 6 months. Usually that's a good target to have. Okay. But like I said, the most important thing is to plan and plan ahead well. Okay. Take enough time off of work, or if they allow you at work to work from home, perfect. Because the first couple of days, like I said, you're some patients after surgery, they ask me, well, can I go home the day after or 2 days after? And I usually tell patients, if a typical trip with us kind of means flying here on a Monday, doing labs, cardiology examination on Monday, surgery on Tuesday, and then departing on Saturday. Okay. So that means you're basically staying Tuesday, Wednesday, Thursday, Friday. So 4 post-surgical nights, which give us enough time to round on the patient, see the patient, talk to them, and all this makes the post-op process a little easier rather than just having surgery and saying goodbye, Yes. So that way, once the patient is back home, he or she has seen us work with them, for a while, how we make dressing changes, all those little details that, aren't the first thing you think about. Most patients, the first thing that comes to mind is, what's it going to cost me? Yeah. Number one. And number two, how it's either going to be how long do I have to stay there, or how long will I have to stay off of work. But most people don't think that. So it's very important to take those things into consideration. And like I said, just make sure to have the support network to be able to perform these surgeries safely. Okay.
Awesome. And I'm hoping we can make this a 2-part, because there's a lot of things with the different procedures that I'd love to discuss that we didn't really get to today. But if we could cover that again next month, I would love that. And I will see if my ladies have any questions. I'm going to take a quick scroll and see if we have any specific questions here today. And then I say I'm going to make a post about it and get everybody to gather their questions that they have, research any specific surgeries that they're interested in, so that we can kind of discuss some of the nuances of, what's first, what's next, what can you combine, where do you kind of want to go in your post weight loss journey.
Yeah, of course. And, I'll just, leave, your audience with the following thought. The weight loss journey is not, it's not an immediate thing. You don't want to rush it,
No.
number one. And number two, once you're comfortable enough with where you are and you feel you want to do something about it, surgically speaking, then, yeah, by all means, explore. But always do it, rather than have price point be your number one marker, which, like I said, unfortunately, a lot of people make it to be that way.
Yes.
Have it be safety. Go with the practice that gives you that comfort level of knowing that they're doing everything in your best interest.
Yes.
Because these are big surgeries, and so these are complex procedures that if you don't take things seriously and you say, oh, well, yeah, I'm just going to go get all this excess, it's a big procedure. We're in the OR for 4 to 6 hours, putting your body under stress. So you want to make sure that you're under the care of a team that can help you with that, whether it be in the U.S., Canada, Mexico, wherever, but just more emphasis on that rather
Yes.
than the dollars and cents. And
Yes.
I'm positive that you are going to have a much better experience, better post-op recovery, and just better communication with the medical team to make sure that you are with a set of people that are going to be holding your hand throughout the whole journey. That's what I think is the most important thing about this, and the details, will fall into place.
And remember that this is about your health. Your body is the most important vehicle you will ever travel in. And how many of us would take our car to a backyard mechanic to save a couple $100? Like, realistically. I know when I was younger, these are things that I did because of finances. But now, I certainly wouldn't take the most valuable vehicle I will ever travel in and take that to a backyard mechanic to save money. So I never recommend anybody other than you. I won't lie. When I met you,
remember, it's a big team. There are a bunch of specialists here in our practice that love their job. We absolutely love seeing, our practice is very diverse, on every given day. One day we're seeing patients with post-bariatric surgical surgeries. Another day we're seeing somebody with spine problems, lower back issues, infertility. So you name it, we have a lot of talented people that, don't nearly get enough credit as they deserve.
Your whole staff is amazing. And your cardiologist, he is so charming. I've never spoken to a cardiologist until I met yours. Even when my mother had a heart attack, the cardiologist didn't have 2 minutes to speak to our family. And he talked to me like a real, legitimate human being person who wasn't just a number. So I appreciate that. And the care that I received at your facility, I can't even say how much above and beyond the level of care that I'm used to receiving in Canada that was. And I know a lot of people feel that when they travel for care, they're going to be taking a step down in quality. And I can say from personal experience, it was the biggest step up I've ever seen in medical care.
Yeah, it shouldn't be that way. I mean, it is definitely a possibility, and the uncertainty can definitely be a little daunting and saying, well, where am I going to end up? That's why it's important to maybe talk to people that have gone to that facility or have experience with somebody that went through those doors. But yeah, I mean, I always tell people, especially Canadians, you're not sacrificing an ounce of quality.
No.
The only thing is, in certain cases, because again, and I want to reiterate, there are a ton of very qualified physicians in Canada. The medical care is astonishing. The problem is the access. Okay, and some patients don't want to wait 2 years to have their spine surgery. And so they say, "Can you see me soon?" And so when we tell them we can see them in 2 to 3 weeks, then their eyes just are wide open and they say, "I'm in."
6 months waiting list in Canada.
That's one of the things. You want to make sure that you're not sacrificing quality. Basically, what you're doing is trying to get quicker access to a good medical team that can perform it in obviously safe, organized manner.
Excellent. Well, thank you so much for your time today and for your patience with all of our technical difficulties. We appreciate your time, and I can't wait till next month when we get to part 2.
Yeah, sure. Like I said, I mean, you let us know if
Yes.
you want to follow up, because this
Yes.
is a big topic. And so,
It is.
I mean, if you want to have people, I don't know, chime in or whatever, we're all for it. So just let us know what your audience wants and how, they want to do this to make it a little as interactive as possible, and we'd be more than happy to do so.
Awesome. Thank you so
Okay.
much. We look forward to next month. Have an amazing Monday. Bye.
Awesome, Dory. Yeah, you as well. Take care. Be well. Bye now.
Okay, guys, I am off to run and pick up Jacob, but definitely leave me your questions. This needs to be a two-parter. There's a lot more that we need to dig into on this topic. So I'll see you guys tomorrow. We're going to do Taco About It Tuesday, and I have a spicy secret. We're going to do a giveaway at tomorrow's Talk About It Tuesday. So stay tuned. You're going to see it posted. See what you can win. See you tomorrow, guys.